Hi, my name is Lacey Knight, nursing student at BSC. I will be performing my IV skills today. So I'm going to show you the room. This is my site. So my MAR. Okay, and that's just labels. Okay, so to start off with, I would have gotten my MAR and reviewed my MAR outside of the room. I'd also review any pertinent lab or assessment data that has to do with this, and I'm going to make sure that this is a medical necessity, that I understand the reason. And all of that fits. I have gathered my supplies and they're set up in the room. I have my waste receptacle and my sharps container. So those are ready to go. So I'm going to go ahead and come into the client's room now. So I would knock. Hi, I'm Lacey. I'm going to be your nurse today. We're doing hand sanitizer. My hands. Okay. Hi. Can you verify your name and date of birth for me, please? Shirley Coast. Date of birth 5/14/2001. 5/14/2001. Yep, that matches. Do you have any allergies, Shirley? Oh, allergic to codeine. Okay, wonderful. Okay, all of that looks good. So now I'm gonna raise her bed to a reasonable height, pretty tall. So I want her bed nice and tall for me. And then once I have her bed raised to a reasonable height, I'm gonna go ahead and wash my hands and get my gloves on. Hands washed. Shoot. And gloves on. My gloves are a little too big. That's okay. Okay, so now that I have my gloves on, I'm gonna go ahead and take a peek at my saline. So this is the saline that I brought in with me. Before I open the package, I'm gonna perform my first medication check. All of the 7 rights of medication administration. So correct patient, correct medication. This is saline, dose, that is correct. We're gonna hang it so we know the route, we understand the reason. Shirley, do you understand the reason that we're hanging this medication today? Okay, so this is being prescribed for you because of dehydration. So we're just gonna start an IV. It'll be a quick poke. We'll leave a catheter in your arm and then you'll be connected to the saline to help provide you with hydration. Do you have any questions? No questions. Okay. The date and the timer right. So everything looks good there. So we've got our first medication check finished. I am going to go ahead and open my saline. Got my saline open, and I'm going to just make sure that my bag is intact. It's patent. Good. I'm also going to make sure, like lightly squeezing it, but I'm going to make sure that there's no sediment in it, that it is clear, not cloudy, and it's also not discolored or expired. This bag looks good. So we're going to go ahead and put that up here. So that is ready to go. The next thing that I am going to do is open my pump. I'm sorry, not my pump, my tubing. Open my tubing. My tubing here. Get that open. I'm gonna make sure that my cassette is closed so that when we spike it, medication doesn't go all over. Okay, we're gonna set that down. Then I'm going to perform my second medication check. I'm gonna do the 7 rights of medication administration again against my MAR. We're making sure that this is the correct everything, and it is. So we are good to go there. So now I have my second medication check done. I am going to get my tubing ready to spike and prime. Making sure that I'm doing this aseptically. So we're making sure that clamp is closed, lids are on. Once I have my bag ready and my tubing ready, I'm gonna open my bag. Okay, we're gonna open that, and then I'm gonna carefully open my spike. I'm going to spike my bag, not touching anything. Gotta keep it clean. It's a tiny little bag. Okay. Not touching the ends, I'm just poking it in there. I'm gonna push some air out. Ooh. And my bag is leaking. Okay. Shoot. Let's see if we can fix this so that I don't have to completely redo this whole video. Because I do not have more supplies on hand. Okay. I was given a very tiny bag and a big spike, so I think we fixed it. Let's see. Yep, okay. Fantastic. In practice, I would clearly not be taping a bag and doing that. I would get a different bag. But for the sake of this video and the limitations that we have on supplies, I just taped it. So, okay, so I have my tubing, I have my bag spiked, I have my clamp on, and I filled my drip chamber less than halfway full. The next thing that we are going to do is we are going to make sure that my tubing is primed. So I'm gonna do this wasting as little medication as possible. So we're just gonna open the clamp. We're gonna let the medication run down until it reaches the end. And I got a little bit of drip. I'm gonna close my clamp. Then I'm gonna check my tubing for bubbles. Anything larger than a champagne-sized bubble will need to be removed. Not seeing anything yet. I'm also gonna invert my ports as I go. We'll just make sure there's no bubbles stuck in any of these little connectors. There's a little bubble. Okay, we're gonna, any connectors or ports are gonna get inverted. Okay, looks good. Gonna unclamp that for a second so I can get the bubble out. Unclamp, reclamp. Okay. My roller clamp is open. Ooh, there's a big bubble. Turning the big bubbles into smaller bubbles. It's very bubbly. But we're getting them to move up. I bet you've spent a lot of time watching videos of people flicking bubbles out of wines. That would be my guess. I'm sorry. Okay, I'm gonna flip. Invert that port. Also, we're just making sure I got a couple bubbles in there. I gotta flick them free. Come on. Can't wait to learn all the tricks for this to make this easier. Okay. Awesome. All right, I got my bubbles to come out. All of my bubbles are free. Line looks good. No bubbles. Wonderful. Okay, my lid is on still. I'm gonna go ahead and pull tubing. We are going to put this in here. There it is. There it is. Okay. Got the end. And make sure that this is hung in somewhere I can get to easily. Okay. I am then gonna label. My tubing per my facility policy. Okay. So we're gonna just label that how it says to label it. The next thing we're gonna do is I'm gonna open my extension. And I'm gonna open my saline. I am aware this is not saline, but for the sake of the video, this is gonna be saline. So, okay. And I still have my lid on, but I'm going to just gonna prime this without wasting. So, got my extension primed, and I'm checking to make sure there's no bubbles. And I do not see a bubble, not one. Maybe. Okay. And bubbles for us. Okay, there's that. That is ready to go. Okay. So now we're going to put our tourniquet on my patient, clearly explaining to the patient what we're doing and why. This is going to just be tight for a moment while we look for a vein. And I'm going to look for vein most distal for the patient that I can start this IV on. So I think that this is a good site right here. So then we are going to remove tourniquet. I'm going to clean my site. And I'm going to allow that to dry completely. While that is drying, I'm going to open my needle. It's a little challenging with these gloves. Okay. My needle ready to go. My site is completely dry. And I am going to put the catheter back on. I have chosen a site kind of mid forearm. I want the tourniquet. I want the tourniquet to be 5 to 6 inches proximal to the site. So I'm just gonna do upper arm here, but not at the elbow. Okay, so I have my tourniquet in place. And I'm going to anchor my vein above or below and above. And I'm going to bevel up, line my needle up, and I'm going to insert at a 15-degree angle. So in we go. Okay, I have flashback, which is amazing. So now at this point, I'm going to go in just a 1/4 inch more, and then I'm going to start sliding my catheter down as I slowly move my needle back. So I've got my catheter all the way in, so it is touching skin, and I'm going to remove my needle, and I'm going to put the safety on. I'm going to throw my needle away, and I'm going to release my tourniquet. Okay. All while I have my hub secured with my other hand. So the next thing we are going to do is we are going to attach, and we're going to test for patency. So I'm holding my hub. Okay, I'm attaching my extension, and we are going to flush 3 to 5 mils for patency. Yep. And I'm assessing as I'm doing that to make sure that there's no swelling, coolness, anything that looks like it's gonna to be infiltrating the area. Okay, as I do this, I'm also gonna hold just above my catheter site. So I'm holding my catheter and I'm holding above my catheter site. I'm removing my saline flush. Okay, and now that I know that it's patent, I can go ahead and I can put my Tegaderm on. And this I'm going to, and actually, you know, I would still have my short extension attached. I wouldn't have taken that off. Okay. So I've got my Tegaderm attached. I would still have this attached. This would be attached. Okay. So I've gone up to my hub with my Tegaderm. I take this off. This is my little label. We'll put it right here so I can, we'll put another piece of tape. Let's put it across that. Okay. That I'm going to, actually I'm going to secure that after I attach it. Okay. I didn't need this label because I've already labeled my area with this other one. So we'll put that over there. All of these here, here, here. Okay. So I've got this attached. So now that I have all of this attached, and I have this labeled and the tourniquet is off, I'm going to do my 3rd medication check on my patient. So I'm going to check my medication against the MAR and make sure it's the right medication. I've gone through the 7 rates. Everything is good. I'm also going to check the rate and make sure that that matches the prescription, as that's a part of the prescription, and set it. Make sure it's good. Yeah. Okay. We are good there. Next, I'm going to detach this. Gonna make sure we clean. And I'm gonna attach my tubing. We're gonna make sure we're unclamped everywhere. We're unclamped there. Tubing is good to go. I gotta run out of tape for the end of my skill. Okay. And we're gonna tape the tubing to the arm securely. Okay, so tubing is taped. I would use more tape than that in a real situation. Okay, tubing is taped. So now I'm just gonna document per my facility policy of everything that I just did. So I've got all of that finished. Now we are going to move on to the part of the video where I turn this into a saline lock. In order to turn it into a saline lock, I'm first gonna assess the site. We're gonna make sure it doesn't look like there's any phlebitis happening, that it hasn't infiltrated. This site looks fantastic, very happy site. Next, I'm going to pause my pump. I'm gonna make sure that my clamps are on, which the cassette is in place, so I don't need to do that. Clamp is on. We're gonna make sure this is clamped. We're gonna remove the lid. I think so. We're gonna remove my IV tubing. I'm gonna hang it just so I can reuse it. Then I'm gonna take, I'm gonna clean my hub. Clean. Okay, I've cleaned my hub. Then I'm gonna take my saline. I'm gonna aseptically attach my saline to the hub. Gonna unclamp it. And I'm going to flush with saline. Okay, we are good. Saline is going into the arm. So now we have this saline locked, which is awesome. Moving on from there, we have, I'm just making sure I got everything. I did. Okay, so moving on from there, we are going to remove the again, an extra alcohol prep pad, that's fine. We've got a doctor's order to remove the, when I would take the saline off also. So we've got a doctor's order now to remove the catheter. So first thing I would do is check the doctor's order, make sure it makes sense. I'm gonna come in, I'm gonna pause my pump. I'm going to assess the site, make sure it looks okay, and move on. We're gonna start taking all the adhesive off first. I'm gonna take all of my adhesive off while I am securing the site for sure. I'm securing my site, and I'm gonna pull it out, just straight out, back it straight out next to the skin while I have my gauze over the top. I'm not gonna put any pressure on until I've got it all the way out. So I'm gonna pull it out. And once I have it out, we're gonna put pressure, and I'm going to inspect the catheter tip, and I'm gonna make sure it is completely intact, which it is, totally intact. So that's wonderful. That's gonna go in the sharps container. I'm gonna peek and make sure everything looks good on the site. I'm gonna tape. I'm gonna tape. I'm gonna tape over the area. We've got a little bit of pressure and we are good to go. And now we are just gonna document for per facility policy, everything that I did, time, amount left of the medication, making sure to document that that I saw that the catheter tip was intact, and send Miss Coast on her way. Thanks so much.